Good evening. I'm Kelly Wright. Thanks for joining me as we spend the next hour together. I'm hoping you're safe and well, taking care of yourself and your family because you matter. Opening observations tonight. History being made at the White House here in the nation's capital today. President Donald Trump and Israeli Prime Minister Benjamin Netanyahu, along with the foreign ministers of the United Arab Emirates and Bahrain, signing an historic normalization agreement today between Israel and the two Arab countries. The president calling the occasion a moment that marks the dawn of a new Middle East. Speaking of history, it was also made on Monday at the White House when the First Lady of the United States held a roundtable discussion to discuss sickle cell disease. It's the first time it's been done since 1983 that any presidential administration has taken time out to proclaim that they have a vested interest in stopping and finding a cure of this dreaded disease known as sickle cell disease. In fact, the administration has gone on to say that a cure is within reach. The Food and Drug Administration approving new treatments and more are on the horizon. And several initiatives are now underway to make better use of all available tools in the battle against this disease. I should point out that sickle cell disease is a chronic, debilitating, inherited condition that afflicts 100,000 Americans, primarily African Americans and Hispanic Americans. And those who attended the roundtable discussion on Monday are now stating that a better and healthier future for our children is within our reach. And those are my opening observations. So joining me now is the man who's on the forefront of not only dealing with the coronavirus pandemic, but so many other health issues that affect our nation. He is Admiral Brett Giroir with the White House and with the Health and Human Services and public health and everything that he has to deal with. Sir, you have so much on your plate. There are so many questions I could begin with, but the elephant in the room right now is this coronavirus pandemic. How is the White House dealing with it? And are we mitigating it? Are we flattening this curve?
So thank you for having me on. It really is a pleasure. We do know how to flatten the curve and save lives, and we've really implemented that over the past couple of months in a very significant way. Since our post-Memorial Day surge in numbers of cases, by just doing simple things like wearing a mask, watching our distance, avoiding crowds, good hand hygiene combined with smart testing, we've reduced the numbers of cases by about 48%. We've reduced hospitalizations by 49%. We've reduced the number of patients in an ICU by 62%. And our deaths are starting to go down. We're down by about 33% from our peak. This does not mean we're out of the woods. We are not out of the woods yet. But it does mean that we do have the tools and we know how to flatten the curve. But everybody has to be on board. Wear a mask when you're in public and you can't physically distance. That doesn't mean when you're taking a run through the woods. That means when you're going to be in, close proximity, like in the grocery store or somewhere else when you're in public. Watch your distance, particularly indoor crowded places. Wash your hands, and combined with that smart testing, we know how to solve this.
So, Doctor, I've got to ask you a question then, based on what you just said. Those are all science-based approaches to dealing with this virus, to flatten the curve, to protect not only yourself, but our loved ones and our neighbors. We should care about that. Are you at all concerned when you look out and you see campaign rallies where people are not wearing masks and they're in close quarters indoors?
Look, human biology is inherently non-political. Anytime people who are together in close quarters and not wearing a mask, there's a risk of transmission. That's the way the virus is. The virus is going to do what the virus does. That's what the virus will do. So we really want to urge everyone to wear a mask when you can't physically distance, and particularly when you're indoors in crowded spaces. We know because of bars and crowded restaurants that indoor crowded spaces are a particularly ripe environment for this virus to spread. And again, we're doing so much better nationally, but that can turn around in a heartbeat. And we don't want that to happen. We need to continue that downward trend. If we want to watch football and open our economy and get our kids back to school, the number one thing to do is decrease community transmission, and we know we can do that. Now, look, if you get sick, we've got good tools, remdesivir. We know how to treat you better in the ICU. We've got steroids. We've got convalescent plasma. That's all great. So if you get it, your chances of dying are a lot lower than they were, but we don't want people to get it at all. So we can prevent this by those simple measures.
Absolutely. And Admiral, you were talking about remdesivir. What about a vaccine, the clinical trials? Where do they stand, and how important is it to get African Americans and other minority community members involved in the clinical trials?
Well, let me answer your second question first. It is the number one topic we talk about every morning. Francis Collins, the secretary, myself, Steve Hahn, the director of the FDA. We really do need to have minorities involved in clinical trials because we want to give you the assurance that the vaccine will work and be safe in minority groups. Now, most of the time, almost always, but not always, if it works generally in a human population, it's going to generally work. But, we don't want to be generally. We want to make sure that African Americans have the data that says this vaccine is going to be effective and it's going to be safe in them. And the only way we could know that up front is to get people to enroll in clinical trials. So we really urge people to do that. And I also want to say that there's a lot of rhetoric around there, but the American people have to understand that we are doing this by the book. If a vaccine is authorized, it is going to be effective and it's going to be safe, given what we know about it. Now, some vaccines, you don't know exactly the safety profile for years, but you know pretty much that the vaccine is going to be safe. There's nothing really unusual about these vaccines. We know that most people get over coronavirus. That's a good thing. They get over it because their immune system responds. So we're just trying to get that immune system to respond to a vaccine instead of the real virus to provide protection. We're very hopeful. Doesn't mean it's going to happen. Doesn't mean you can not wear a mask and hope for a vaccine, but we are hopeful it's going to happen. Nobody can tell you when, November, December, January. The trial has to take place. When the trial is done, when we reach the number of infections and we can show that it's effective, then the trial will be over, but not before that.
Absolutely. We're going to come back from the break and talk about another important factor, and that is sickle cell disease and the work that you and the First Lady and Jerron Smith and so many other members of the Trump administration have been engaged in to combat this terrible disease that's affecting so many lives. Back with more of Admiral Giroir right after this. Welcome back to the program. So I'm talking to Admiral Brett Giroir, and yesterday, sir, you participated in a roundtable on sickle cell disease along with First Lady Melania Trump, who convened this important roundtable to discuss where we stand on dealing with sickle cell disease. And my understanding is that this is the first time that a presidential administration has gone out to tackle this disease since 1983. Am I right?
Well, you're right, but I don't think any administration's really tackled it. The last proclamation by a president was in 1983, and basically the White House has been silent about sickle cell until President Trump issued a message in 2018, a message in 2019, and now an official proclamation. And this really coincided with so many products that my office had been working on over the past couple of years to make a tangible difference for people living with sickle cell disease, sickle cell trait in their families. I'm a pediatrician. I'm a pediatric ICU physician. I ran a health system for children in Dallas, and I took care of so many children suffering with this disease. And really, it's something that's touched me my entire life. And also have a very good sort of my third daughter, who is one of our mentors, who I've known since third grade. My wife and I are very close with her. She has sickle cell disease, so we've sort of grown up with her. She's 31 now, so we've grown up with her and have seen everything she's been through. So it's professional and personal. And one of the things that I think everybody who comes to Washington brings their passions with them, and this is one of my passions and why I wanted to be Assistant Secretary, because one of our missions is to work on health disparities. And I think everybody knows that sickle cell disease has not benefited as much as other diseases. We have a lot of work to do, and we can get it done.
And that is what's so important. You put a face on it yesterday during that roundtable discussion. And as you mentioned, it was quite heartbreaking and yet revealing in terms of showing the hope and the encouragement that so many people are seeking. I was struck by the fact that there are quite a few who said, we must sound the alarm. We must make this a public reality that everyone knows what's happening in terms of dealing and combating sickle cell disease. And on this program, as well as this network, that's certainly something near and dear to us, because we do need to inform America what's going on. And we do need to applaud those such as yourself and others who are trying to increase our abilities to get out and have the type of medical remedies that is so necessary.
Absolutely, and we need to talk about it. I mean, there's a lot of stigma around the disease too, and a lot of discrimination, a lot of misunderstanding. Sickle cell patients are in a lot of pain. They need opioids. They need non-opioids. We got to be careful that we don't sort of sweep them up into the opioid crisis, because they have excruciating pain that needs and deserves treatment. So we're working on that aspect too, and we've had special sort of carve-outs from the opioid regulations to make sure that people with sickle cell can get the pain medications they need. But more important, we now have drugs that can limit the pain crises. We know how to limit the risks of strokes, of kidney disease. So again, my office deals with health disparities. We want to eliminate health disparities, but often health disparities, if you look at it, it's such a huge problem. I mean, we've had health disparities in our country that has plagued our nation for centuries. We need to fix that, but let's start with a tangible issue. We know who have sickle cell. We know the treatments they need. We know they're not getting the best quality of care. Let's fix this. Let's start with sickle cell deserving Americans and people around the world whom we know we can help. Let's make this as an example of what we can do as a country. I love moonshots. I love Mars shots. Well, what about a sickle cell shot? Let's fix this. We have this within our control. And, I'm just fully committed on getting it done. I don't never want to admit another child to the hospital in excruciating pain or with a stroke. We can avoid this. Let's do this together.
Admiral, I appreciate you, sir, for coming on the program today and sharing these insights and this knowledge, this information, and the science, getting the politics out of the way and driving down to the nub of it, and that's getting people healthy again and saving lives.
Yes, sir.
Appreciate you, sir. Don't be a stranger to this program. Okay.
I'd love to be on any time. Thank you.
All right. And we'll be back with more after this. On Monday at the White House, First Lady Melania Trump and Admiral Brett Giroir conducted a roundtable discussion on the important topic of improving the lives of Americans battling sickle cell disease. Joining Mrs. Trump were doctors, researchers, advocates, and patients who participated in the discussion to determine a strategic plan and blueprint for action to ultimately find a cure. The First Lady pointing out that children's well-being is a pillar of her Be Best initiative, noting that the effects of sickle cell disease often begin in early childhood.
Unfortunately, the effects of sickle cell disease often begin in early childhood and can cause episodes of extraordinary pain that put patients at risk for organ damage or stroke. We have made progress in treating this disease early. Identification and new life-saving therapies can help. The President has signed a bill that funds research and treatment, and the administration has launched a program to provide new training for healthcare workers. But there is still much more to do. Through leadership from HHS and Admiral Giroir, an administration announced funding to increase the use of recommended medication for children. HHS has also partnered with the National Academies of Science, Engineering, and Medicine to publish the strategic plan and blueprint for action to address sickle cell disease in the United States. And today, the Centers of Medicare and Medicaid Services is releasing a new national sickle cell disease infographic that will provide important information to both doctors and patients and improve the quality of care across the country.
Jerron Smith, director of the White House Domestic Policy Council, described a very personal account of sickle cell disease.
Sickle cell disease is painful, chronic, and inherited disease that afflicts 100,000 Americans, primarily African Americans and Hispanics, and millions around the globe. That is why it is so important that this administration has focused on making actual change and creating policies that improve the lives of the vulnerable. At the direction of the President, we have made huge changes to empower minority communities in many different ways, like by improving infrastructure, creating better economic and workforce opportunities, and addressing health disparities in America. President Trump has also done more for people living with sickle cell disease than any other administration before. The President and First Lady have provided opportunity for children and families in minority communities who have been previously overlooked. Nearly every African American has a family member impacted by this disease. That, of course, includes my family. I have a niece and a cousin who've spent many years in the hospital, and I'm thankful for organizations like Make-A-Wish that's made their hospital stays at least somewhat comfortable. And I'm blessed that they were able to get the transfusions and things they need to be with us today. Data tells us that 1 in 13 African-American babies is born with sickle cell trait. They carry the gene for sickle cell disease, and 1 in 365 African-American has sickle cell disease.
We'll be back with more after the break. The patients explained how they are battling the disease, among them 12-year-old Samuel Price, who is a patient at Children's Hospital in Washington, D.C.
The pain still happens every once in a while, sometimes, but the feeling is, it's like a scrape. It's like, say somebody had long nails and they scrape their nails against a whiteboard, against a blackboard, and you hear a screeching sound. It feels like that inside of you, and it hurts.
It does bring tears to your eyes because you are not able to avoid the pain for your child. And as he said, it's excruciating pain that you can never imagine, and you don't know how to fix it except take him to the hospital. And the hospital workers sometimes don't know what to do either, and they're also hospitalized for quite some time. We have many doctor's visits. We have many pulmonary doctor's visits and a lot of specialists that we have to see on a regular basis. Right now we're at 3 months visits every 3 months because he's on the hydroxyurea, which definitely helps him. However, I do feel that now that he's getting older and he's going to go through puberty, I'm not sure how effective it will be. So we are hopeful that there will be a cure soon, very, very soon.
I did not experience the effects of sickle cell until I was 11 years old, which is not something that usually happens. But when I did experience the effects, it wasn't as bad as it is now. Now I'm in the hospital almost every month, and I can definitely say that being in college has made it worse because of the stress. I'm a college student, I'm a senior criminal justice major. I'm very hopeful in the future that we will have more for sickle cell disease, more options for cures, more medications. The one thing with sickle cell is no one in this room that has sickle cell looks as sick as we are. You can't tell. You can't look at me and say, oh, she's sick. Oh, she's in the hospital every month. And even when I come out of the hospital, I actually just came home from the hospital on Sunday. But you can't tell that I was in the hospital. We just really need help with this disease.
I'm extremely proud of my daughter. She's been an advocate. She talks about sickle cell whenever she can. She spoke at colleges, but like she said, you look at her and she looks like everything is okay, and she's really good at that. You know, I just sit back and I think about the nights when she can't sleep, when she's in a lot of pain, a lot of the missed opportunities, things she's not able to do because of the pain. And she tries her best not to, you know, let sickle cell hold her back and restrict her from anything, but sometimes, you know, that happens. So, you know, I just try to support her in any way I can. I'm a nurse, so I see it from the parent side where I'm sitting with her in the hospital room. I also see it with my patients, treating my patients, so that does help me, you know, kind of give me a little more understanding of what my patients are going through.
I'm excited to have your time and to be in front of you. I know that your campaign is the Be Best campaign, and you're really passionate about children and bullying and the well-being of children. But me, as an adult living with sickle cell, I've lived both worlds. I've lived in the pediatric world where you're completely catered to, you're not disbelieved. It's like we're like little princes and princesses when we're in the hospital as kids. But when I got to college and the different stress, and then you have a doctor tell you to your face, I don't think you're in pain. I think you just want pain medicine. That also ties into your opioid abuse initiative as well. Sickle cell patients, as adults, we become bullied by the medical system, the healthcare system, by uneducated doctors, and we're also victims of the opioid crisis because we are a minority illness. I would love it if you could become our ally and make this cause your cause as well, because as a woman who hates bullying, stick up for us who are often bullied by the healthcare system.
Thank you, Shamanika.
So thank you.
Thank you very much for your story and for your strength. That's why we are here today, so we could help children and adults.
Let's be honest now. There's black kids just like my brother Samuel that are hurting. Why did it take from '83 to now for someone to start being their voice? Come on, America. Come on. We got people that are hurting. It's time to actually put action forward and stop just talking about things and having all these political discussions. People like my son and so many others need America to come together. And thank you, Admiral, and thank everybody in this room for being the voice for kids just like my own. God bless you.
My brother Marcus passed away on June 22nd. He was 36 years old with sickle cell disease. His vision for sick cells was we got to get the story out there because, you know, as we mentioned, sickle cell is an invisible disease, but our community is suffering. You know, we talk about the progress we made here, and this is historic to be speaking to officials at this level because the reality is we suffer. We suffer every day. What you see here is not what happens in our households. So we go out into the community and we interview sickle cell patients and we put their stories next to their faces. Because what you don't see is in order to get Marcus to a conference, he had to go to his cardiologist, he had to go to his pulmonologist, he had to go to his respiratory therapist, he had to get blood draws, blood gas, he had to take an enormous amounts of pain medications because the reality was up until last year we didn't have treatment options. So our pure goal is to make sure that the patient voice is heard and that it's clear so that we can eliminate stigma and improve the quality of life for people living with sickle cell disease.
We'll be back with more after the break. Welcome back to the program. I'm delighted to introduce to you Pastor Juanita Erasmus, and you can see behind her is called Learning to Be. That is the name of her new book that comes out today. So I'm delighted to have her on to not only talk about her book, but to talk about what went into the writing of that book, what made it come to life. Pastor Juanita Erasmus, good of you to join us today.
Well, thank you so much for having me, Mr. Wright. It's an honor to be here with you and your guest.
Well, thank you. And drop the title, just call me Kelly, please.
All right, fair enough. You'll call me Juanita?
That's right, because anytime you're on this show, you become a friend. It's instantaneous, yes! I like to say.
All right.
All right. So my good friend Juanita is going to tell me about this wonderful book called Learning to Be. And Juanita, it seems to be a book born out of things that you went through and struggled with in order to become the better you. What did you have to go through?
Woo! a lot, all right. You know, the scripture says, unless a grain of wheat falls to the ground and cracks open and dies, it cannot bear fruit. And so literally my experience with having been diagnosed with a major depressive episode became for me that dying, that cracking open, and the realization that I had lived my life for so long with a narrative that no longer served me. And so this experience that I call the crash in Learning to Be is my story about what it's like to experience what the early church fathers and mothers called the dark night of the soul. So often we think of depression as simply a mental health diagnosis. And in reality, I believe it's an opportunity to recreate our lives, a life that we can live with.
That is so important, Juanita, especially given the times in which we find ourselves living in. Now, historically, Black Americans have gone through a lot of difficult times, as we know. 400 years of dealing with the struggle of just to be seen as equal to our brothers and sisters of different persuasions. That being said, though, we've come this far by faith. How did faith help you overcome depression? And the second follow-up question to that is, we should be talking more about this, shouldn't we?
Oh, absolutely. Can I take that first one and start with that?
Yep.
All right. So you said we should be talking more about this. Kelly, this is one of the reasons why I'm excited about this book, because I believe we have to begin to break down the walls of shame around talking and discussing about mental health challenges and illnesses, mental health diagnosis, period. COVID-19, the social justice uprising that we're experiencing, we're all learning to be in a very different kind of experience in our lives. And it's having an effect on us mentally, emotionally, and no doubt spiritually. So for me, yes, we've got to talk about this, because there are probably going to be more people experiencing some type of mental health challenge during this quarantine, during all the highs and lows of this experience. And then, of course, the idea and the notion of being at home alone, which so many people are. So yeah, this is a reality for us. This is not just about depression, but it's about mental health and our ability to address our needs and concerns in a period of disorientation.
Wow. Wow. And now that you're living this life, I want to take a break and come back and talk about how other people who are going through similar situations, because even the former First Lady of the United States, Michelle Obama, stated it quite candidly that she was experiencing some low levels of depression, and she addressed it. And it still seems to be the big elephant in the room that no one wants to talk about, especially among Black Americans. We don't like to look at it. We don't like to talk about it, but we need to talk about it. That's why.
Oh, absolutely.
So when we come back from the break, we're going to talk to Juanita Erasmus, pastor in Houston, Texas, a mega church. We're going to talk about her church, what she and her husband are doing, and everything that she can provide for those of you and even me who are watching and listening to learn from her. Back in just a moment. Welcome back to the program. So I'm talking to my good friend, Pastor Juanita Rasmus. We've just become good friends. I'm going to stay that way forever. And she has written a book called Learning to Be. And learning to be is a process that each and every one of us must learn. But when we go through tough times, Juanita, like we're going through right now with this COVID-19 pandemic, and as you talked about earlier, the social unrest, the racial unrest, and seeing so many things that affect us.
Exactly.
And hurt us and grieve us. And if we have no place to let it go, it just gets built up, right? And it causes us to either lose control and somewhat and figuratively lose our minds.
Exactly. Now, I said earlier that I had created a narrative for myself. The brain is so incredible. The brain lays down neural pathways, and you can think of it as like a highway. And when you're used to getting on the highway and getting in a certain lane so that you can get to your destination, you can almost do it without any thought.
Yeah.
Well, what I realized is that in the case of depression, the brain sets down this pattern. But often the pattern got established before the depression set.
Okay.
And so for me, it was about learning a new way to be. One of my therapists said to me, Juanita, you're going to have to live with this diagnosis for the rest of your life. And when my therapist said that, I was crushed. You mean I'm going to have to feel this and experience this forever? Well, years later, in reflection, as I was beginning to write the book, I realized that really wasn't what he was saying, but it was what he was saying. Okay. What he was saying to me is that the things you're learning about how to become your most authentic self, you're going to need to learn to live with those forever if you want to take advantage of what this experience has to offer. I think so often, unfortunately, mental health has always been taboo in the Black and brown community, and in the Asian community as well, from what I've understood. Yeah. I think what we have to recognize is that the mind, body, spirit work in conjunction with one another. There are now things I can see that were leading up to this experience, but I didn't know how to name it as, at the end of this, we're going to crash. All I knew is that I was carrying a load emotionally. As a good little girl, part of my narrative, I had always believed that you could be mad, happy, glad, and sad. And if you were mad, you better get glad. And so that said to me that you shouldn't have any kind of anger. You shouldn't hold disappointment. You shouldn't have grief. What do you do with it when you can't get mad, when you can't say, this is unfair? All you can say is, when you ask me how I'm doing, I'm fine.
Yeah.
And so we hide behind these masks. We hide behind these narratives. And it's time for those of us who can to step out and make it clear, make it less taboo, to recognize that our minds can only take so much, just as our bodies can. When the bodies are stressed, they respond. And so for me, I'm just grateful that when the Spirit said, take notes, that I took notes.
And you're the pastor, the co-pastor of Omega Church. Tell me, if you will, about your church in Houston and how it was to be a leader and then find yourself just kind of saying, whoa, what's happening here? I'm off balance, and I seem to be spiraling out of control, and yet I've got to keep it together because I'm the leader of this major church in Houston, Texas. Folk depend on me. Got a husband who's a co-pastor. He depends on me.
My children. Exactly.
Yeah, your children. Everybody's depending on you.
Yeah. And, and unfortunately, again, it goes back to the stories we tell ourselves that everybody's depending on us. So that was one of the first myths that unwound in this experience. But in terms of the church, my husband and I started St. John's 28 years ago with 9 members. It was primarily a congregation built around the homeless community that lived in and around downtown Houston, and often found our church as a place of respite at night where they could sleep and be unaffected by people messing with them or being more vulnerable than necessary. And so from there, we began to provide meals on a daily basis to the homeless community, then showers and laundry. And then ultimately, Tina Knowles and Beyonce Knowles, Solange Knowles helped us to build the Knowles Roland Center for Youth. And then additionally, the Knowles Timonos Apartments, which is a housing complex for formerly homeless individuals. And so we have about $30 million worth of housing in downtown Houston. We are now so engaged with our nonprofit, the Bread of Life, Inc., which provides groceries and housing products and supplies and that kind of thing. We started that shift after Hurricane Katrina, when 1,000 people showed up at our doorstep and said, we need help. They knew we had been helping the homeless community. And so it just became a natural next step that we should help people in crisis. And so we are providing, as an example, thanks to COVID-19, about 1,000 families a week with groceries. These are families who never would have expected that they would have to drive through our line to get groceries and sanitary products and personal care items and all that kind of thing. These are men and women who have been working hard and have late model cars, but who've been laid off in the oil industry and various sundry businesses and companies that have folded due to the effect of COVID-19.
When we come back from the break, I'm loving this conversation because it's such an important conversation. We can talk about politics all day long. But what we really need to talk about is what really matters to each and every one of us at home. So when we come back, we'll continue our dialogue, our conversation with Juanita Rasmus as we wrap up what it means learning to be, because each and every one of us need to see that there's a better me. We'll be back after this. And the one thing I admire about you is when you had your TED Talk, I admire the husband in your life.
Me too.
Who was able to endure, but not just, and when I say endure, maybe that's the wrong word. He stayed there to support you against all odds. Tell me about that so that other men like myself will be listening, become more sensitive to what we may encounter in our life.
Well, you know, it's real simple. What I came to realize is that I was so depleted. I slept 18 to 20 hours a day. And so my husband became wife and mother. My daughters to this day laugh about the fact that he would comb their hair and put office rubber bands in their hair. And you don't use office supply rubber bands in little girls' hair. But what I think made all the difference is that my husband took our wedding vows very seriously, for better, for worse, for richer, for poorer, in sickness and in health. What my husband did was stayed. He stayed put. You know, fight and flight is a real experience when a person is under stress. But what my husband, and he talks about the experience in the book, but one of the things my husband did was to every day decide that he was going to keep loving me. And I'm gonna tell you, Kelly, that wasn't an easy thing, because I remember laying in bed, and I'd been in bed so long, for weeks, for months, and I would turn my head and I would smell something, and I would think to myself, what is that? And I turned my head, and that odor seemed to linger, and then it came to me, that was me, because I hadn't been able to get out of bed to take care of personal hygiene. And yet my husband every night got in bed and never once complained. But one of the things that I think became helpful for him is that while I was seeing therapy, he also got counseling, and so did our daughters, so that they could have some experience of how to cope with this. Because you see, when one person in a family has a health diagnosis, whether it's a mental health or physical health diagnosis, the whole family is sick. The whole family needs a process for healing and for recovery. And so what I would say to anybody who's living with a person with mental illness, seek your own support system. Counseling, talk therapy, support groups. There are now a number of organizations that I didn't even know about at the time that provide support groups that are no cost. So Google them. You know, this is September, National Suicide Prevention Month. If you are in pain, mentally and emotionally, if you find yourself thinking, is this all there is? Then I want to encourage you to reach out. Reach out to a trusted friend, reach out to a clergy person, reach out to a therapist, find help. You don't have to suffer in silence. There's resources here to support you.
Hey, my friends, make sure you check her out, Juanita Rasmus, black, white, brown, yellow, whatever color you are. Check out her book, Male, Female. Check her out. Learn how to be, learning to be. Thank you, Juanita. God bless you.
Thank you. God bless you as well.
We're coming back with more after this. And welcome back to the program. I want to thank all of the guests who appeared on this show tonight. I appreciate each and every one of them. And I especially want to thank you for taking the time out of your busy schedule to watch. In closing, my final word is this. Hopefully we've been righted and ignited tonight to be united, to keep spreading knowledge and find a cure for sickle cell disease, and to help people who are feeling depressed, and to help people understand that we must continue to spread love, freedom, and peace. Good night.
Come on, all aboard. Let me break it down for you like this. The rhythm of love is easy to find if you're listening. The color of light isn't red, black, or white, but it's crimson. We all bleed the same. If you don't feel the groove, it's alright. Just give it time, give it time. Come on, y'all. Get on board. Mankind won't survive if our hearts beat inside a hateful rhythm. You see, love isn't bought, but comes with a price of forgiveness, and we all bleed the same. Yeah. If you don't feel it now, just wait. It's coming on, the love train. Just give it time, give it time. Get on board. That means you, and you on the love train. Get on board. All creeds and colors, brothers, all sisters and brothers, and sisters on the love train. Get on board the love train. Everyone's invited. We're all united on the love train. Get on board. All creeds and colors.